10 minutes.
Ladies and gentlemen and fellow speakers, Dr. Sabath, I feel a little bit unfair when the health issue comes on the stage. Look at the audience, nearly 2/3 on the outside. Can somebody go and bring them back, please? That's my first request. My second request, rest of the audience, please stand up. Please stand up. 3 claps on your head. And please sit down. Now, at least you can take some message from my talk. Is anybody coming in, or shall I continue? See, this is what, in general, people does, not only Tamilians, rest of the world. They always concentrate on how you make money through education, industry, corporate setup. But when they come to their own health, they don't care. Especially men, they're very disappointing. Usually their partners, their wives, bring them. So my talk today, let me introduce myself for those who don't know me. My name is Shanmugaraj. As I grew up in Coimbatore in Tamil Nadu. And when I went to United Kingdom 1981, they asked the initial. And I showed my passport, it said Palaniyappa Gounder. So they changed it to Palaniyappa Gounder Shanmugaraj, just like my dearest friend Palani G. Periyasamy. He used to be Periyasamy, became Palani G. Periyasamy. All right, so for the benefit of local people, especially British whites, it's not easy for them to call the whole name Palaniyappa Gounder Shanmugaraj. So I shortened it as PGS Raj. Interestingly, a few years later, I operated on a prostate patient, that's my specialty. He called me and said, what does it stand for PGS? Then I said, Palaniyappa Gounder Shanmugaraj. He said, no, it's a prostate gland surgeon Raj. And he found another conundrum. So every speak I make in UK, now I introduce as prostate gland surgeon Raj. Okay, what's prostate gland? So I give you a bit of introduction of prostate gland and just touch the tourism, because tourism has been well covered by Janaki Raman. Prostate gland. Before going to prostate gland, a lot of people confuse with urology and neurology. And I tell them, if they're confused, I tell them neurology is a top man, urology is a bottom man. So I'm a bottom man. And because most of my work is prostate gland, which is in the bottom of men. Prostate gland is men-only gland, which lies in the pelvis, below the urinary bladder. It gets larger after the age of 50. Please raise your hand, men in this hall more than 50 years. Right. You have 90% of chances to suffer from prostate gland symptoms, mainly urgency of urination and going to the toilet often in the night. Because they wake a few times in the night, make a noise in the toilet, their wives wake up as well. So it is one disease, but affects both sexes. And you have to be very careful in getting it treated. Prostate gland, when it grows bigger, it causes problem. And you must seek medical opinion, surgeons or doctors' advice. It can be age-related enlargement, like a cataract, or there may be a cancer in it. 1 in 10 men, after the age of 50, in your lifetime, you carry a risk of prostate cancer. So I think it's probably about 20, 25 gentlemen more than 50 here, and at least 3 people will have a prostate cancer in your lifetime. So take it seriously. When you have this problem, I'm going to show you some slides quickly. Slides, please. Where do I press? Oh, yes, yeah. That's an anatomical situation. Now, I want you to remember this picture, whoever in the audience. The first picture shows the prostate gland appearance in a young child, male child. The middle one, about that young age, when they get married, when they do family and all. But the last one is the one you get after the age of 50. So see the shape of it, and it can trouble with your urination. So these are some of the symptoms. You can read it yourself. And one gentleman came in with this. He couldn't pass urine for 2 days, and look at his urinary bladder in the belly. It went up to here. So we have to put a catheter immediately. So you have 20% chance if you don't get it treated. And then the urologist feels the consistency of the gland and differentiate. Sometimes you feel the cancer, but most times you don't. So you need other tests, like a blood test. And then you can have a look inside, and that's the way prostate looks like inside. Thank you. Thank you. Now, before going that slide, the blood test called PSA is vital. After the age of 50, you must have PSA, which stands for prostate-specific antigen. And you should do it once a year and get examined by a urologist. But if you have a family history of prostate cancer, then you should start screening yourself from the age of 45. And if you don't get it treated, this is what you get: a big pocket in the urinary bladder due to pressure. The treatment of the age-related enlargement, we give tablets first. If the tablet fails, you go for surgical treatment. The surgical treatment, this is before your operation. And this is after the treatment. We call it descaling the kettle. And one of my patients said, I can feel like a hose pipe now. Okay, the PSA I mentioned earlier on, you should relate it to your age. If you are 40, more than 2.5 is alarm. And as opposed to 70 to 79, upper limit, normal limit is about 6.5. Then you do the staging, biopsy, scan, and this is where we pick up prostate cancer. 66% picked up when it's within the gland in United Kingdom, because they come for an annual screening and they have MRI scan and biopsy. But in India, a lot of people come with, that advanced stage green. The green is 66% in India. Maybe it's going down. Now, one of the innovations in the last 15 years, this is a talk I gave in Chennai during the first World Conference. The cancer prostate, we remove them using robot. This is a theater setup for the robotic surgery. We do that for a localized prostate cancer, but if something spread outside, then you go for a hormone treatment. And that's the hormone is given. Thank you. So this is the end of my slides. But before I finish, just touch upon how many minutes? Only 1 minute. Well, it doesn't matter. Medical tourism is covered. I just want to touch one thing. The simple thing we can do as a medical tourism is bringing healthy people from Europe and US, Middle East to India, or even South Africa, and give them one or 2 weeks tourism and then master health checkup, including their PSA. So otherwise, medical tourism is failing in India. I know they are trying for the last 20 years because the following reasons: visa problem, complications of the treatment, who will pay for it, how long they can stay. And then when they go back to their country of origin, who will look after the aftercare? And then finally, the insurance problem. The insurance people in America and Europe, they don't recommend all the hospitals. It should be JCA accredited. JCA stands for Joint Commission International, which works under the umbrella of World Health Organization. So there is a problem. Thank you for listening.
Thank you, Dr. Prostate Gland Surgeon Raj.
Thank you. Well said.